My name is Sebastian Pereira, and I welcome you to St. Anthony's Health Talk series. Today we are going to take a little insight into the COVID-19 strains and its effects on all those who are infected. We will also be looking at the black fungus disease, the symptoms that one gets, and the treatment options that are available. All of us may have got a lot of information from the WhatsApp University and all the other social media sources. But I'm sure when we get it from a doctor who's actually practicing, we will be able to be confident that whatever information we have is correct. Before we begin this talk with Dr. Jarvis, let us hear from the person who is responsible for all these initiatives that are happening in our parish, our very own parish priest, Father Felix D'Souza.
My dear friends, in this parish we have a health wellness cell, like the various other cells and associations. What we have done so far is to have a meeting with people connected with hospitals, with healthcare, and concrete thing we have done is to have every month prior to the lockdown, 2 minutes talk by a doctor or healthcare person that will help us to remind us about how to care on the basics of our health. We are having now a talk by the doctor precisely because the fear of the pandemic is there with us. We have struggled, we have survived, we have coped, and we hope for the best. Many questions come to our mind. Will there be a third wave? What about the black fungus? What about the Delta variant? All these and many more questions in simple ways and means will be answered by the doctor. We need to take care of our health. Probably we have taken our health, our life, and even God for granted who gave us life. The main message of the pandemic seems to be that we now have to care for our health because health is wealth. And there is a spirituality behind it. Because the Lord says, I have come that you may have life and life in fullness. So if He has promised us life in fullness, the health that we are given, we need to take care of it. We are not always proud that we have done our best. Look at the pollution. Look at the climate change. Look at the disasters that are happening via nature. All these are because we have not cared for creation. And not cared for creation means we have not cared for health. I want to take this opportunity to thank Dr. Jarvis. He's a great man from this parish who has music as his hobby and he takes healthcare seriously, ENT specialist. He has been with us through the pandemic, helping us out, and today he has been the resource person. I thank the host, Sabi Fernandez, the event coordinator, Zina, the recording team, Stephen and others, the editing team, Hector and collaborators, and of course, our very own parish communication cell. As I say, from last year till this year, irrespective of the fact that we have not had physical presence and meetings and functions, we have connected with you. We have come across to you to give you a message either via the daily masses, Sunday masses, programs on various events. The parish communication cell, along with others, have been responsible. We thank them and have a great health which God has given to you. God bless you.
Thank you, Father Felix, for those wonderful words. We will now begin with our interview with Dr. Jarvis. Known as Dr. J by many who know him, is a multi-talented personality. He is a doctor by day and a musician by night. He has immense love for music, and we have seen him many times in our church choirs and participating in various programs organized by our church. As a medical professional, Dr. Jarvis is an ENT doctor and surgeon and operates from Holy Family Hospital. Thank you, doctor, for joining us.
My pleasure.
What we would like to talk about today is the various strains of COVID and the nomenclature around it.
Right. So the virus by itself is called SARS-CoV-2 or COVID-19, and there are many known strains. As scientists have kept studying this virus, right since the inception of the pandemic back in 2020. Well, the first strain, what we now know, is called like an alpha variety of this strain. Okay, so there are Greek alphabets to label the different strains. So we have alpha, beta, gamma, delta. I'm sure delta being one that we have more recently heard a lot about. So alpha was the first strain, originated in England. Beta was found in South Africa. Gamma was found in Brazil, and delta was found in India. And in fact, the delta variant is what's caused most of the morbidity of this virus in the recent few months, not only in India, but now we have heard reports that it has spread all across to Europe and even the United States. So the delta variant is what the variant of interest or the variant of concern right now, because this is what's causing most of the problems in today's world.
So, doctor, talking of the delta variant, which you are talking about, and what are the signs and symptoms one should be wary of?
Right. So, before I get to the signs and symptoms, I just want to very quickly add a brief note about why did we have so many variants. So, the virus, as we know, is constantly mutating and constantly changing. It's a very intelligent virus. So, what it does is, it's finding ways and means to change and avoid our immune systems, right? So there's constant genetic mutations which keep happening. And these genetic mutations can either make the virus more deadly, or sometimes it can actually make it powerless and the virus dies away. And that's when the pandemic ends. But in this case, what we're seeing now is that the virus has mutated and become a more deadly variant. Okay, and why deadly? Because it causes more morbidity in the body. It spreads more easily from person to person. So more transmission, more signs and symptoms. So coming to the signs and symptoms, the cardinal symptoms of COVID are fever, cough, and breathlessness, right? And something very pathognomic would be loss of smell and loss of taste. Well, what we're finding with the new variant is that you can also have additional symptoms such as a runny nose, a sore throat, a headache. And these are not so common symptoms. So what may seem like a normal flu may actually be COVID.
So doctor, what are the investigation methods or things that one could get to know whether the person has got the delta variant?
I will answer that in general, not just for the delta variant, but for COVID in specific. If you're talking about signs and symptoms, which we've already touched upon, the investigations and methods to diagnose this viral infection. So first of all of us have to be alert about symptoms, right? So if you have a fever, if you've started coughing, okay, and you sometimes you can have just weakness which is out of the ordinary. You feel very lethargic, your muscles hurt, and your overall you have body ache. You got to start being alert. This could be something more dangerous than just a simple flu, right? So methods to diagnose, I would say first and foremost, we usually get a chest x-ray, but more than a chest x-ray, a CT scan of the lungs. Okay, a CT scan of the lungs is something that tells us a lot about whether the patient has been infected with COVID or not. Okay, what happens is that the virus causes very typical lesions in the lungs, okay, and these are very accurately picked up by a CT scan. Okay, so an x-ray may or may not show that, but the chest, the chest CT scan, it's called HRCT. The HRCT will, 90% of the time pick up the characteristic lesions seen in a COVID infection. Okay, there's ground glass densities, there's peripheral opacities. I won't go into the details, but a simple CT scan if you're coughing a lot, and of course if you're dropping saturation, that's extremely important. If you're dropping saturation, you've got to get a CT scan done. That will tell us whether you have a pneumonia, and now we can also grade this pneumonia. So there's a severity score out of 25. So we can say an 18 on 25 or a 20 on 25 pneumonia. That's obviously a more severe variant of the pneumonia. Now, apart from a CT scan, one of the things you must have heard of that everyone does is the swab, the RT-PCR swab, right?
Correct.
So this is one thing that we use to pick up the virus. Now what this does is basically you put a swab into your nose and you're basically searching for viral RNA. That's what this test does. Sadly, the test is not extremely sensitive. So sometimes, maybe 3 or 4 out of 10 times, you can have a false negative. So suppose your swab is negative in the initial part of infection due to lower viral loads, you might get a negative report, and that might sometimes fool you into thinking, oh, I don't have COVID. Okay, but we have to remember to keep monitoring our saturation, keep monitoring our temperature, our pulse, because all of this helps us in understanding what's really going on. And few days later, if you continue to have symptoms, then you know that something's wrong. And we can always repeat a swab later on, or you do a CT scan and you arrive at the diagnosis. Of course, there are additional points such as blood tests. Okay, so we do inflammatory markers, and inflammatory markers give us an idea of what's happening within the body. So if you have an increased CRP, D-dimer, ferritin levels, these tell us that, okay, there is more inflammation in the body, and this could be related to a viral infection like COVID.
Okay. So doctor, say in case somebody is having all these signs and symptoms, what type of doctor should he see? Is there a specialist that he needs to get in touch?
So let me answer this. In an ideal scenario, you need to see a chest physician or an MD medicine, an internal medicine physician, right? But many times in our country, a specialist may not always be available. So you need to go to any doctor that's available and who's dealing with cases in general, who will be able to guide you to tell you, do these tests, and maybe you can start off with certain medication that we commonly give for COVID. So the doctor to see would probably be a chest specialist like a pulmonologist or an MD medicine, internal medicine physician.
Okay.
So just to summarize methods of diagnosis, the ideal thing to do is to get a chest CT scan. Apart from that, we do supportive blood investigations, including a CBC and inflammatory markers, and without forgetting the swab, of course, the RT-PCR swab. Sometimes if you don't have access to a swab, you can also do a rapid antigen test. Of course, it has much lower sensitivity in picking up this virus, but if it comes positive, you have it.
Correct.
Okay, and sometimes, okay, you can get swab negative where the CT scan is unsure. You have a grading of 3 and 4, CORADs 3 and 4, where you're not sure, could this be COVID, could it be something else? We can also do an antibody test. Okay, so if you do a blood antibody test for COVID, it can actually tell you whether you've been exposed to this virus in the past. So if you have a high level of antibodies, it either means you're vaccinated or it means you've suffered a natural infection in the past, right? So in which case it kind of rules out a current infection. So I think those are the most common ways to diagnose COVID.
Okay, doctor. So say suppose somebody is infected with COVID, what are the treatment options available?
For treatment, we have to understand what's the main problem first. The main problem is in the lungs, right? The lungs have a pneumonia, and very commonly what we see is the patient goes into something called acute respiratory distress syndrome, that's called ARDS. This is what causes an oxygen requirement. ARDS is what causes your saturation, which should be in the range of 98 to 100 in a healthy adult. This ARDS causes the saturation to fall. And now the patient starts needing oxygen. So I would say the main treatment, of course, in a dropping saturation would be pure oxygen, right? So we need to give oxygen in different forms, whether it be through nasal prongs, through a mask, through a BiPAP machine, or even a ventilator. Yeah. And apart from the oxygen, now coming to the medical treatment, see, a viral infection in most cases is usually dealt with by the body's immune system. Our job is to supplement that immune system and to help the body clear out the virus as soon as possible. So one thing that we do very commonly, of course, you must have heard of the name remdesivir and tocilizumab and itolizumab. Now, these are special medications which were not actually made for COVID, but we are now using them. We have found that there is some benefit.
They're effective.
They are effective in some cases. So, for example, remdesivir is an antiviral agent, and this injection, what it does is it just lowers the viral load in the body. But it's to be given early on in the disease. That's when we find it's most effective. There are also times when it doesn't work. Okay, so we tell the patient this, that there is a chance that it may or may not work. In some patients, we do see good response. So remdesivir is one of the most common drugs that we use. Of course, itolizumab and tocilizumab. Now, these are monoclonal antibodies that basically suppress the immune system. Now, what we need to understand is many of the signs and symptoms we see is because of our body reacting to the virus. So it's our immune system which overreacts, you know, and you have a drop in blood pressure, you can have all the symptoms that we see. So basically what this drug does is it kind of shuts off the immune system just for a short while, and the inflammation in the lungs comes down, and we see the oxygen saturations coming up. But as a consequence, because your immune system is now shut, you can have secondary infections cropping up.
Correct.
So, of course, these drugs have their own side effects, and we do counsel our patients before we administer them because they are special drugs. And there are lots of new drugs in the market now. Scientists are constantly working on different molecules and remedies to treat COVID. So, one of the newer ones is an antibody cocktail. It's called a monoclonal antibody cocktail. Of course, it costs over $1 lakh, but they're finding good results with it when they're given in mild disease early on. Okay, so we have imdemivab and casirivimab. These are the two monoclonal antibodies that are used. So the monoclonal antibody cocktail is one of the newer drugs. Okay, then we have Virafin, and we have 2-oxy-D-cholate. Of course, I'm not going to go into details, but these are some of the newer drugs that are coming up. Of course, more studies are required. But if you go to any hospital treating COVID, one of the first things that they probably start would be remdesivir, in addition to the oxygen. If the patient is deteriorating, we might also add tocilizumab or itolizumab. And in addition to this, we always want to basically address the problem of an oxygen requirement. So one of the first drugs we start is a steroid. Okay, so we start injectable methylprednisolone or dexamethasone. I'm sure you all have heard of Dexa being one of the most common drugs being given, right? So steroids. Then we have blood thinners. COVID has an increased tendency to cause your blood to clotting, right? So what we do is we start the patient on a blood thinner just to make sure that there is no clot happening. Now, this clot can either happen in your heart, you can get a heart attack. If the clot happens in the brain, you can get a stroke. So you can see that it can cause a lot of complications. So steroids, blood thinners are very commonly used in the treatment. And of course, we have vitamin supplements, right? So we have vitamin C, we have multivitamins, we know zinc helps. So we give zinc as well, we can give magnesium. And earlier there were drugs like doxycycline and ivermectin which were being given, but now we don't have enough evidence to really say they work. But in COVID, I believe it's better to overtreat than undertreat. So we might as well give the drug and hope for the best. So these are some of the most common drugs we use, in addition to the main, of course, being the oxygen that we give the patient when the saturation is on the lower side.
So doctor, say suppose with all these drugs that are given to the patient is recovered. Okay, so what happens after that? Is there any special care that he needs to take, or any other medication that is required post the recovery?
So that's a very good question, you know, because many times you have an illness and you recover from it and you're fine. Sadly, in COVID, now it all depends on what severity of COVID did you have. Did you have mild COVID? Did you have severe COVID? So mild cases, once they recover, they actually don't need many medications. Okay, but in severe COVID, when someone has recovered from a very severe infection, what we find is patients can have shortness of breath and weakness for a much longer period, even after the viral infection has passed away. Okay, so and this can be because of different reasons. One of the most common being stiffening of the lungs. So we have a condition called pulmonary fibrosis which happens, and this causes the oxygenation in the lungs to be affected. So what that means is some of them can have long-term oxygen requirements. Okay, so even after you recover and get discharged from the hospital, some may need more oxygen when they go home as well. So one of the most important things that we tell patients who've recovered from severe COVID is to keep monitoring their saturation. You need a pulse oximeter. In today's day and age, that's like your best friend, right? Anytime you feel...
It's an everyday gadget now.
Absolutely. Every day when you feel, is this COVID or, what's happening, you put on the pulse oximeter, you check your saturation. But of course, in a patient who's recovered, they usually have reduced baselines. Okay, so they may have just a saturation of 90 to 93% even after recovering. Okay, and that tells us, that depends on the degree of fibrosis in the lungs. So based on the saturation level, we advise the patient how much oxygen they might need. Okay, they need to titrate this through trial and error. So they see whether 2 liters of oxygen is enough to bring up the saturation, above 95, 96. So post-COVID, monitoring your SpO2 and pulse is important, because the minute you see a dropping saturation, it could mean that you've now had a secondary infection also. Not a relapse per se, but what we have is secondary bacterial infections in the lungs. So you can get a bacterial pneumonia over an old COVID lung, right?
Okay.
So that is something you'll only pick up if you're monitoring your saturations. And of course, if you have symptoms like fever and cough all over again, then there's something to be investigated. Okay, so post-COVID, monitor your saturations and keep tabs on any further developing symptoms. Okay, in addition, life after COVID can sometimes be difficult, because earlier, say you could walk for 20 minutes or half an hour without feeling tired. Well, now, because your lung is no longer working as it was
Full
before,
capacity, yeah.
maybe you might find that even a 15-minute walk makes you extremely tired, right? So what we say is we need to gradually mobilize the patient, where we make them do exercise, but you have to remember that you can't overdo it, okay, because your saturation might suddenly drop and you might start to feel very sick. So you need to gradually ease yourself back into your old self. But the problem is it might take time. So in elderly patients, of course, it takes longer to get back to their original strength. And the younger ones, of course, they do it much faster. But it is difficult, because there are many different complications that we are now seeing. Now, what happens in COVID is we are giving a lot of steroids. Okay, so this is something which suppresses our immune system. And of course, there are patients who abuse steroids even when they don't need. Now, you ideally need steroids only if you have an oxygen requirement. But sometimes people take steroids just like that. Steroids can suppress your immune systems. And when your immune systems are suppressed, you can have a multitude of problems. Okay, so you can have, like I mentioned, secondary bacterial infections, and you can even have fungal infections. I'm sure you've heard of black fungus and things like that. So life after COVID can be difficult unless we keep monitoring, and our bodies will tell us, how we're feeling. So if the body is telling you you're not feeling good, you're having symptoms of fever and things like that, please go get it checked, because this could be a secondary infection.
Talking about this black fungus disease that you just spoke about, can you tell us a little more about what this black fungus is?
So the black fungus actually, I think, is a misnomer. Okay, the actual medical name of this condition is called mucormycosis, okay, or zygomycosis. Now, this is basically a fungal infection.
Okay.
Now, in you and me, where our immune systems are in good order, funguses usually don't affect us. Okay, so there are fungi in the air. Most commonly, these fungal spores are found in decaying organic matter, in maybe animal excreta, or in the soil.
Something that is rotting.
Yes, exactly. So you can have fungal spores there, you can have it in the air, and sometimes we even inhale them, but nothing happens to us. Why? Because our immune systems are intact, and they deal with the incoming fungal spores, and they make sure that the body does not suffer an infection.
Correct.
Now, what happens in patients who are immunocompromised? For example, somebody who's on chemotherapy, or somebody who's taking long-term steroids, like in COVID, where they have taken steroids for almost a month or 2 months. Our immune systems are now dysfunctional, they are suppressed. So now these fungi can now dominate and cause an infection. Okay, so a little bit of black fungus. Why is it called black? That's not the color of the fungus. Let me make that very clear. Okay, so mucormycosis is caused by 2 or 3 types of different fungi. The names being rhizopus, rhizomucor. These are just some of the names. And what happens in this disease is, when say a particular organ gets affected, for example the nasal mucosa inside our noses, if that gets infected by mucormycosis, what happens is there is reduced blood supply, okay, and there is something called microembolisms which happen. Embolisms being clots are formed in the blood vessels supplying this the skin in the skin in the nose, and now because of those clots the skin turns black. Right? So it's a sign of dead tissue actually, and so you see black scars. It can be in the nose, it can be in your throat, in your heart, palate. It can be in different places actually. So that's with the name of black fungus.
So, doctor, black fungus, when they say, what are the signs or symptoms that one could read in order to identify whether he or she is infected?
Okay, so the signs and symptoms depend on the type of
Fungi.
zygomycosis that you have. For example, let me elaborate a little bit. You can have different organs being affected by mucor, okay, and based on that you'll have different symptoms. Okay, so one of the most common ones that we see is called rhinocerebral. Okay, rhino being nose, cerebral means related to the brain. Right? So our nose and our eyes and our brain, they are very close to each other. Now for example, if a fungal spore goes into my nose, say I'm immunocompromised and my immune system is down, now the spore kind of hatches out into more fungi, and now I have a fungal infection in my nose.
Okay.
So what are the symptoms that could happen? Just imagine, if my nose is infected, I could have nasal block, right? So I might feel stuffiness in my nose. If the mucosa is significantly affected, you can have a little bloody discharge coming out
from the nose.
From the nose itself. Some people can have some mucus coming out as a reaction.
Okay.
Okay, you can have pain in your nasal area. Now, the nose is very closely connected to your sinuses. Okay, so there are different sinuses all in your face. If these sinuses get affected, then those particular areas can become painful. For example, we have a maxillary sinus here somewhere near our cheek. So this part can start paining. Okay, your cheeks can start paining. You can have pain above your eyebrows. Okay, there's ethmoid and frontal sinuses out here.
Okay.
So this area can have pain. Okay, so pain in these areas, the eyeball can get affected, and this is something very commonly that we see because the sinuses are in very close conjunction with the orbit. Okay. Or the socket for the eyeball, right? So if your eyeball gets affected, then eye movements become painful. Okay, so you can have blurred vision, you can have a swelling in your eye, your eye can become red, and based on the area that's affected, you will have that particular symptom. Now, from the orbit and from the sinuses, they are in very close conjunction with the brain and with our CSF, which is a cerebrospinal fluid, right? So if that fluid gets infected, now we have the infection moving on to the brain. Of course, if your brain kind of starts getting affected, you can have a variety of symptoms. You can throw a seizure, you can have severe headaches, right? There are lots of different symptoms that we can see. Now, this is rhino-orbital cerebral variant of mucor. Okay? Now, you can also have a pulmonary variant of mucor. When I say pulmonary, it means to do with the lungs. So, if the lungs get affected, you will have something very similar to COVID, where you have fever, cough, shortness of breath. Okay, there is also a gastrointestinal variant, which means that your intestines get affected. Patients can have diarrhea, bloating, severe abdominal pain. And there is something called cutaneous mucor. Okay, cutaneous is basically an infection in your skin. So, for example, if you've had surgery recently, or if you've had burns, okay, your skin can get infected with the spores, and now your skin develops lesions. Okay, so that's called cutaneous mucor. And of course, there's a variety where it's everywhere. That's called disseminated mucor. Okay, so that means you can have the entire body gets involved thanks to an infection starting from anywhere. It could be your lungs, it could be your nose or your sinuses, anywhere really. So based on these are the most common signs and symptoms that we see. So if you have a long-standing headache, a blockage in the nose, discharge that's not going, and you've recently taken steroids, see, you have to understand that this mucormycosis is not something that happens in healthy
Regular
adults.
patients.
Yeah. Now we are seeing that post-COVID there has been a rise in these cases. So maybe the virus is causing a significant immunosuppression that's causing even healthy adults to get this sometimes. And when I say healthy, I mean those who have just recovered from COVID. They've in the past not been diabetic, they have not been on steroids or any drugs that suppress the immune system. These people are also susceptible to this fungus right now because COVID itself has caused
The immune system to
to go
go down.
down by itself, and of course the steroids and things that they take for the COVID infection also suppress the immune system even more after that, right? So I would say even the healthy ones need to be alert because it's a dreadful disease. See, once you get the disease, the prognosis is not very good, especially in cases who come late. So if cases come, when it is already spread, the mortality rate is almost 50 to 60%. Okay, that's very high. So I would say prevention is always better than cure. So you be alert for any of these signs and symptoms. If you have any doubts, just go to an ENT surgeon and get it checked because it may be mucor, you never know. Or it may just be a simple flu or a sinus infection which can also be treated, but it's best to exercise caution in these cases.
So doctor, what are when you say we need to go to a ENT, what are the treatments or the diagnosis?
How do we reach the diagnosis?
How do we reach a diagnosis?
So I must tell you that it's not easy to really diagnose this disease because sometimes you can have a paucity of symptoms, right? Not everyone will have all the symptoms that I mentioned, and not everyone is thinking about mucor. So sometimes you might think it's something else and you may not pick it up. So the best method is to actually culture this fungus that's taken out from wherever you're having the symptom. For example, if you're having it in your nose or your sinuses, you go to an ENT surgeon. What he does is he puts in a scope, it's called an endoscope, okay, and we look at the tissue inside, okay, and we look at one particular area, maybe that's black or that seems to be affected, where the mucosa does not look healthy. So what we do is, we do a biopsy. We just take a piece of that yes, we take a piece of that tissue out and we send that tissue for testing. Okay, now that tissue we can run fungal cultures, fungal stains, and these basically the tissue is looked under a microscope, and then you're isolating that particular fungus. So you can see the rhizopus, you can see the septate, hyphae and things like that, parts of the fungus. So if you're seeing that on a microscope, then you know that you're dealing with a case of mucor. So the ideal method of diagnosis to say that this is mucor would be like a biopsy or a culture of that particular body fluid under a microscope. But just to summarize, how do we go about it? So what we'll do is we'll also do blood investigations. Okay, we will do a CT scan or an MRI. Okay, now sometimes we might do even both. Okay, so we have contrast enhanced CT scans of the nose and paranasal sinuses, or we can even do an MRI. Say if the eye is affected, we can do an MRI of the orbit, right? And of course the brain as well. And radiologically we find if there's tissue destruction, bones are kind of eroded, then we know that okay, these signs and these signs on the radiological investigation are more in favor of a fungal infection. So we put everything together. We put the signs and symptoms of the patient, the history of the patient, that they recently took steroids, or they're recently immunosuppressed, or they're diabetics, their diabetes is out of control. Diabetes is one of the, I must mention, is one of the main things that suppresses our immune system, right? So we keep the history in mind, we see the signs and symptoms, then we see blood investigations, then we see our radiological investigations in the form of CT scans and MRIs, and of course the ultimate gold standard being culturing the fungus, okay, or the biopsy from, or a swab from inside the nose. Okay, if any of these reveal mucor, then we arrive at a diagnosis of mucormycosis.
Okay. So say somebody is already diagnosed, what are the treatment options that are available?
Right. That's a great question, because I must tell you that this is a difficult disease to treat, right? So treatment options would include both medical and surgical, depending on the severity, exactly. So let's take a patient who has come late. Okay, now what has happened is, say the patient was a 60-year-old lady, just to give you an example. A 60-year-old lady severely diabetic, very poorly controlled sugars. She's immunocompromised. She had COVID, okay? And she was given even more steroids during the disease because she had severe COVID. Now you can imagine her immune system is extremely suppressed. Say she's recovered from her COVID, she goes back home. Say there is these fungi in the air that normally are there. She picks up an infection. Say a week later, she starts to have blocked nose. She starts to have headache. She starts to have a bloody discharge coming out from the nose. And she ignores it. She thinks it's just a common cold or something, and she doesn't do anything about it. A week later, she starts developing pain in the eye. Now she finds that her vision is a little affected, and she's not able to see properly, or she's having double vision, right? So, and after all this happens, even then she ignores it, and say she comes a week later to you. Now what has happened is, in this case, most probably, the fungus has now even spread, possibly to the brain as well. Okay, so here you have a very severe case coming to you. So how would you treat this? The first thing that I would do is obviously scan the patient, right? So we want to see the extent of disease. So if we find that the brain is already affected, and the eye obviously is affected from what we are seeing. We are seeing the eye has become big, it's become red, it's swollen, it's watering, there's discharge from the nose. Now we are looking at a very severe case of mucormycosis. So immediately, medically, I would start her on the first line drug is called amphotericin B. Okay, now this is an injection that's given. Of course, it has a lot of side effects, and we need to keep monitoring creatinine and different levels, but it's one of the most commonly used drugs in cases of mucormycosis. Okay, so we have amphotericin. Of course, there are some other options like isavuconazole and posuconazole. There are different, I won't go into details of those. Amphotericin is what we would start. We would admit the patient, start her on amphotericin, and we would plan a surgery. Okay, so after looking at the scans, we would plan for an endoscopic surgery wherein we go in and we try to take out whatever mucosa has been affected. So for example, say the palate, that's the upper part of our mouths, say that is been completely eroded and eaten into by the fungus. We actually have to remove the whole palate, right? So it's like an amputation. We need to amputate whatever areas we see that are affected. So depending on the severity, you can have a wide range of surgeries as well. You can have a simple surgery where only a little bit of the sinus is affected, and you just clean out the sinus and you drain the sinus, and you put some medicines in the sinus and you leave it. Or you can actually go on to things like where you're amputating the entire affected area. Okay, so sometimes you might even need to take out the eye, right?
Infected eye.
Exactly. So you can have lots of disfiguring surgeries. So it all depends when the patient came. Had the patient come early, we have a good chance of starting medical treatment, and maybe then the patient does not require extensive surgery. But if you have a patient that's come in very late, then you are bound to have a very
lot of complications
and very disfiguring surgery possibly. So if the brain gets severely affected, then you know that in spite of surgery and everything, patient prognosis is extremely poor. Sometimes despite your best efforts, sometimes it may not be enough, and sometimes they come too late, and that's why you have such a high mortality rate in such patients. But medical and surgical, these are the most common treatment options that we have for mucormycosis.
So you are saying if the patient comes to you early, there are chances of recovery even in this?
Absolutely. So of course it depends on your prior immune status. Now for example, if there's a 40-year-old male who's come to me and he's not come too late, I believe that his immune system would not be in such bad a condition as say opposed to a 60 or a 70-year-old
male. That example we just said.
Exactly. So in this case, say if he comes early enough, I begin the amphotericin. On the CT scans and MRIs, he does not have very severe affection. His bones inside are not badly affected. Then definitely, we can cure him. We need to give the amphotericin for an extended period of time till they're having symptoms, or till we see surgically that the mucosa has now become healthy and is now looking good. But yes, we can save the life of the patient, definitely. So coming early really helps.
Okay. So suppose somebody has come early and recovery has happened, like you said, there is a chance of recovery there. Is there anything like the other thing that we spoke about?
Life after So life after mucormycosis, it all depends, like I said, on the severity. Say you had a very mild case of mucor, there are no real long-term complications, right? Because you've come early enough so that we have saved most of your tissue. But say you do come late, then it can be a little difficult because we might have to put things like prosthesis. Now, for example, we take out the palate, we might have to now replace it. Yeah. So it all depends on the surgery that you've had. Your signs and symptoms post mucor would depend on that. So if you've not had very disfiguring surgery, it's not too bad. Okay, but there are times when you've taken out a lot and the patient develops complications, right? So the brain can get affected and things like that, in which life after mucor can still be quite complicated because the patient doesn't fully recover from the infection and they need to keep coming to the hospital for different problems. So really speaking, I mean, it can be a very severe and debilitating disease unless you come early and get it treated.
So doctor, recently we have heard about the Delta Plus. Is it something that we need to be worried about?
So let me be very honest with you. Scientists are still working on this, okay? Like I mentioned initially in the talk, we have variants of interest and variants of concern. Now this is a possible variant of concern because we know that from whatever few cases that have been identified of Delta Plus, we find, or the surgeons, I mean the scientists have found that this particular variant is very easily transmissible. That means it spreads very easily.
Okay.
Also, this variant causes more morbidity, so it's a little more lethal and little more deadly than the other strains. And they are also finding that it has mutated in such a way that it possibly evades immune systems of those who are even vaccinated. Now, of course, this still needs to be studied in detail, okay, but it is possible that the virus is developing certain mutations that are rendering normal treatments ineffective. What I mean by that is, you give remdesivir and you give itolizumab and still the patient does not improve because the virus has found a way to dominate now. Okay, so it is possible. This still needs to be looked into, but also regarding those vaccinated, sometimes even in spite of being vaccinated, we are finding that they get infected. Right? So of course, but still we are very early on in this study, and a lot more research needs to be done about this. So this is ongoing. But yes, the Delta Plus variant is something to be worried about, and the way to avoid it, okay, is just the same things that you would do, how you would avoid
normal COVID.
A normal COVID infection, exactly. So you'd wear your masks at all times, you'd socially distance, and you'd wash your hands and keep sanitizing yourself before you say eat or touch. Don't touch your face and things like that. And of course, one of the best things that you can now do is just go get vaccinated. We know that those who are vaccinated are having lesser symptoms, lesser vaccinated people reach the hospital. So the benefits of vaccination are multifold, and one way to safeguard yourself is just go get the vaccine and hope for the best and continue taking precautions.
Okay, so doctor, with all this around, if somebody actually gets, which is the type of doctor that he has to see?
Right. So the type of doctor in this case would ideally be an ENT surgeon, but let me make it very clear. This is a team approach. Okay, so you need multiple disciplines in treating this disease. For example, you need a good pathologist and a microbiologist to isolate the fungus in the first place. Okay, so your
investigations.
Absolutely. So you need a radiologist to pick up the signs and symptoms on the CT scan and the MRI. Okay, you need, say the patient needs surgery, you need a good anesthetist to give this patient anesthesia while we are taking out all of this, because it's a very difficult surgery to do and you need good anesthesia, right? So you need an anesthetist, you need a pathologist, you need a good physician who started off these drugs. So, and of course you need the ENT to operate, right? So it's a multiple multidisciplinary team that should be in charge of this patient. But the first doctor that you would go to would probably be an ENT surgeon, because most of the time the symptoms begin in the nose and the eyes. So you might even go to an ophthalmologist, because sometimes you can not have nose symptoms and just eye, right? So in that case, depends what gets affected first, but either an ENT surgeon or an ophthalmologist would probably be your first doctor that you'd go to in a case of mucormycosis.
And as you said, early recovery, early detection is more chances of recovery.
Absolutely. So I mean, it all depends, on the age of the patient, on the immune status of the patient, and the extent of infection. So say they are young, say their immune systems are not too bad, and they come early enough, we can probably cure them and send them home. The more elder the patient, the more, say the patient is on a cancer patient, say the patient is on chemotherapy. Now the patient has come with extensive disease. I may not really be able to completely eliminate, the mucor from all the parts in his body that are affected. So I may be partially be able to treat this patient. And sometimes if they come too late, in spite of giving amphotericin, in spite of surgery, sometimes we are not able to save the patients. We do see that, which is why this disease has a high mortality rate.
True. So doctor, is there any message that you want to give our viewers today?
Yes, in fact, this is something that I tell most of my patients who are suffering from or recovering from COVID. See, I'm sure you guys have all heard about the precautions that you need to take to avoid COVID. I'm not really going to go into detail on those. Please get vaccinated, take your, wear your mask, sanitize yourself regularly, etc. But what I want to focus on is, let's develop steps to keep our immune systems healthy. See, the whole reason that people suffer is because their immune systems are not in order, okay? And what happens is, when your immune system is suppressed for any reason, be it diabetes or any drugs that you're taking,
any comorbidity,
any comorbidities, that's when you're at risk of acquiring a COVID infection, mucormycosis, and a whole other host of diseases, right? So I want to tell you guys some tips to just keep your immune systems in good function, so that we are safeguarded to a certain extent. And even if we are encountered with, say, fungal spores or the COVID virus itself, our immune systems will take care of us. So one of the most important things that really hurts our immune system is stress. Okay, we know that stress is a very potent immunosuppressant. So if you're somebody who's stressing a lot and who's worried and tense and anxious all the time, there's a high probability that your immune system is not working at its optimal level. Okay, so stress is something we need to kind of control in our lives. We need to de-stress. Okay, and what are the other ways to keep our immune system healthy? A healthy diet. Okay, what you're eating matters.
Exercise.
Absolutely, exercise. So exercise and healthy diet and restful sleep. We know there are proven studies, patients with, subjects who have slept for more than 7 hours. We have actually done a study where you measure immune system function in patients who have slept for just, say, 3 or 4 hours, and you've compared it to those sleeping for more than 7 hours, and we found a huge difference. Okay, so rest, exercise, diet, de-stressing, these are things in our hands. We can work on these. Okay, so if we work on these, there's a very low chance that we are going to allow COVID to get to us. And of course, get yourself vaccinated. And the other thing that I want to say you've gotten infected. Okay, I'm here to tell you that your brain and your mind has extreme healing powers. Okay, this is something that is not all of us focus on this. But having a positive attitude, say you get infected with COVID, how do you react to this? Do you react by worrying, stressing, and thinking, oh my God,
negative most of the time,
everything is over now, right?
Correct.
If you just change that to something positive, like where you tell yourself that, okay, I've gotten COVID, no problem, I'm going to get myself treated and I am going to get better. If you have that attitude that I am going to get better, let me tell you, no one can stop you from getting better. And this is something I tell all my ICU patients. You believe you get better, your body has no other option than to follow the mind. So if the mind is telling the body, I'm getting better, you will get better. So guys, stay positive. Even if you have an infection, don't worry. There are a lot of doctors around to help you. Stay positive, stay healthy, and we can conquer this pandemic very soon.
So it was nice talking to you, doctor, and thank you
so
for
much.
taking out so much of your valuable time. I know you're really busy, and the profession demands it. So we are not, but we're really thankful that you gave us your time. And
I actually want to say thanks. Thank you for having me over. Father Felix is doing great things for our parish, and I want to say a big thank you to Father Felix for having me. And I would love that everyone watching this be well informed about what are the possible signs and symptoms of this dreaded Delta variant, or be it mucormycosis. Everyone's free to get in touch with me anytime they need. I work at Holy Family, right? So anytime you need a consultation, you can just head over to Holy Family and I'll be there to solve your problems.
thank you so much, doctor. It was
My
really
pleasure.
nice talking to you.
Thank you so much.
I would like to take this opportunity to thank all those behind the scenes who make such a lot of effort to bring such valuable programs to our parishioners. And not forgetting all you viewers who have participated in this program and made it a success. Thank you. God bless.